Hello, my name is Leonidas Hidalgo. I'm talking about physical therapy for mobilization of the parent with a prolonged intensive care unit stay. Definition. We define early movement as an intervention in a mode at a motor, sensitive and proprioceptive stimulus, which generates the parent describes in the negative impact of admission to the ICU. All this will be applied with the intention to maintain or restore strength and musculoskeletal function with the intensive and early application of treatment. Physical activity thus is performance in critical ill patients and thus run from movement passive or escape and even the use of the technique as such as the ergometry to initiate the critical patient in an early mobilization program. We would be in early passive movement, which consists of mobilization each articulates passive. This is intended for the parent, the maintain physiological movement, joint travel, muscular strength, and describes the delineation of bones, mass and indirectly from the draining of respiratory secretion.
Our clinic is a special clinic for very difficult patients. Patients after long bed rest. Those patients who require special neurorehabilitation. The main idea of neurocritical rehabilitation, first of all, is to mobilize the patient and to recover conscious, if it is possible. Conventional therapy consists of tilt table and bicycle training. But during verticalization, we usually face with the problem of arterial pressure drop. We got opportunity to try ergo, where we are able to use stepping and verticalization. When she admitted this hospital, she was still under artificial lung ventilation. And on the second day, we began mobilization with ergo. We were able to liberate her from artificial ventilation. She became fully spontaneous breathing. We were able to overcome the problem with the hemodynamic during the verticalization. So at the upper point, 90 degrees, her arterial pressure was well, and as our TCD examination showed, her cerebral blood flow was equal. In clever hands, this equipment is able to give excellent results, and our patients, even with a very severe head injury, demonstrate very good dynamic.
Application in physical therapy. Intensive care units are highlight specialist services that provide care the critical ill parents are thrown in heterogeneous demand and injury developed due to long periods of sedation and complete immobilization. But rest is often part of treatment for ICU patients. The demand during of stay in the ICU is 3.3 days. And for each day of bedtime in the ICU, the parent spends an additional average of 15 non-UCA bed days. Physiotherapy is ensuring of the mobilization process of the parent to avoid affection of famous conditional syndrome in the parents.
Just take normal breaths in and out for me just now. And out. Good. Good. Okay. Same again. Big breath in for me. And back out. Good. And then last one here. In. And back out. Good. Okay. So the chest is sounding clear. But what we want to do is we want to make sure that your lungs are staying nice and expanded and we're keeping your chest clear. So I'm going to just run through a breathing exercise with you just now. If I can get you to lean forward for me just now. I'll demonstrate the breathing exercise first of all. So what I want you to do is to take a nice deep breath in through your nose, hold it for about 3 seconds and then let it out through your mouth. Okay, so it's in through the nose, 2, 3 and then out through the mouth. Good. And again for me, in through the nose, 2, 3 and out through the mouth. Good. And one more. 2, 3 and back out through the mouth. Good. Okay. The next part of the exercise is looking at clearing the chest. So it's what we call a huff. So the way I explain it is it's like you're steaming up a mirror. So you're doing a okay, can you try that for me? Good. And again. And last one. Good. And next we're going to try a cough, making sure we protect your wound. So I want you to take the towel, hold it across your chest. Apply a pressure and try a cough for me. And again. Excellent. Okay, you quite happy with that? Good. Now we recommend you try that exercise every hour. Okay. Okay. That's if you pop your hands onto the arms of the chair. Okay, just gently have a stand up for us. Good. Hold your hand on this side. Okay. So head up tall, back straight. Just want you to gently start marching on the spot. Okay. Good. Good, keep going. Doing okay?
Good.
This is really important for your chest, helps keep it clear. Okay, so start slowing down for me. And stop. And if you gently step back towards the chair, feel it behind your legs.
Yes.
Reach down for the arms of the chair on both sides. And gently sit yourself down. Perfect. Okay.
Pros and cons. Reduction of hospital and ICU stay, lower mortality rates during hospitalization, better result in terms of quality of life, functional mobility of parents after discharge. Cons. It will depend of the parents' condition, the state of conscience, and the difficulty that they have in their mobility and the equipment to which they are connected. Early unprioritized mobility could worsen the parent clinical picture.
Louise, so we were thinking about a whole lap. 8 times what you did yesterday.
Today we mobilised the patient ventilated on an endotracheal tube. It involved risk assessment of the patients and how their ability is to mobilise, as well as adequate staffing to move the various attachments and medical staff to look after the endotracheal tube to avoid any adverse incidents.
She's a patient with congenital heart disease who has had a difficult post-operative course with respiratory failure. Otherwise, she's made a good recovery and she's not needing lots of organ support apart from the ventilation.
It's rare that we have patients who are on endotracheal tubes long enough to mobilise within intensive care. This patient is one of few who is fit enough to be able to mobilise on the endotracheal tube whilst still being ventilated.
Just do fastest.
The main issue with Louise is trying to get her pushed forward in terms of her respiratory function. So lying in bed isn't as good for your respiratory system. Being able to get up, open your lungs up better, and being able to breathe a bit more, a bit harder while you're mobilising around the ward will all help Louise move forward and hopefully get that breathing tube out in the near future.
Patients who normally are ventilated with an endotracheal tube are normally on bed rest and are not able to get out of bed because of this. So being able to get the patient up to sit in a chair and being able to mobilise the patient will help their muscle strength, improve their power and their ability to move around and mobilise. And also respiratory wise, they're able to expand their lungs more, able to clear any secretions that may be in their chest to ultimately improve their respiratory function. She seemed to have fun and benefit from it. Her family were in attendance as well to see her being up and about on her feet, which is great from a psychological point of view, for her to be able to get out of bed, get out of the room and see a bit of the unit.
Use applied in Ecuador. In Ecuador, the benefit of early mobilization of parents in the intensive care unit have been increased. Since the pandemic, the work of the physiotherapists was more respected and valued, helping parents in critical state to regain their functionality before their clinical state.
Within intensive care medicine, we've gotten better at helping patients survive their severe illness in the intensive care unit. And as a result, we have a growing number of patients who are ICU survivors. As this patient population grows, we're beginning to understand the consequences these patients have when they go home. We've understood that patients have many problems with muscle weakness that prevents them from returning to work and requires prolonged rehabilitation. We've also recognized that there are many difficulties with depression, anxiety, and post-traumatic stress disorder related to their ICU stay. As a result of this, we've begun to rethink how we provide care to patients in the intensive care unit. It's very normal for most patients in the intensive care unit to be deeply sedated and receive bed rest throughout the duration of their stay in the intensive care unit.
It's really important that patients are up and moving, because if they stay in the bed all day, we know that they lose a lot of strength, and we know that they can get tightness in their joints, problems with their lungs.
As a result, at Johns Hopkins Hospital, we've thought about rethinking the way we deliver care in the intensive care unit. We've thought about what if we have patients wider awake and have patients up and moving despite being on life support in the intensive care unit.
We know that one of the worst things we can do probably is to leave someone in bed. So anything that they can do activity-wise, we really try to promote.
We're talking about a shift in paradigm in caring for patients in the intensive care unit, reducing oversedation, reducing delirium, and getting patients mobile when they're in the intensive care unit. We introduced rehabilitation staff, physical medicine and rehabilitation concepts early into intensive care. We now have occupational physical therapists and rehabilitation physicians seeing patients while they're in the intensive care unit rather than at the end of their hospital stay. So what patients overwhelmingly tell us is that they like the early physical medicine rehabilitation. They like being awake. They certainly like getting out of bed and moving. It shows them that there's hope. It shows them that there's a life beyond the intensive care unit and a life for them to get back to. It gives them goals for improvement when they see themselves walking a little further each day. It shows them that they can get better. This is something that I believe other intensive care units can also implement to improve the longer-term outcomes of their intensive care patients.
Conclusion. I conclude that the mobilization of parents who are in a critical condition is stakes that many health workers in intensive care units perform on a daily basis, and that is essential for the prevention of number complications. During the process, the hemodynamic status of the parent would be closely monitored as well as all those devices to which he is connected or has inserted, such as craters and drains. For this reason, the collaboration of different professionals with good training is essential. Thank you.